LiveWire is made possible by the members of 13.
Imagine a clean, well-stocked supermarket, fresh produce, fruits, and vegetables. Now try to imagine it in a poor neighborhood. The reality is that the people with the least amount of money to spend on food have the fewest healthy choices available to them, and government doesn't do much to help either. Inadequate diets in the inner cities, tonight on LiveWire. We'll begin our discussion and take your phone calls at 1-800-245-WNET after news with Louis Dodley.
Good evening. The U.S. commander in the Persian Gulf says the fighting's not over yet. General Norman Schwarzkopf says Allied forces in southern Iraq are trying to stop the retreat of 2 Republican Guard divisions. The Pentagon official says it could be the biggest tank battle since World War II. The UN Security Council meets to debate Iraq's latest offer to renounce its claim on Kuwait in exchange for a ceasefire. Iraq says it will accept some UN resolutions relating to the Gulf War if the fighting stops, but the White House and the Allies say no deal. The McNeil-era News Hour will update the Persian Gulf situation at 7 o'clock. Locally, a Manhattan judge says if city hospitals release the mentally ill homeless, the city has to provide them with housing and proper support services. State Supreme Court Justice Edward Lehner says public shelters or flop houses don't meet the needs of the mentally ill homeless. City officials have yet to comment on today's ruling. The publisher of the Daily News says that if he doesn't get more concessions from striking unions, he'll decide Monday whether to close or sell the paper. James Hogue's disclosure of the Monday deadline comes after 13 months of fruitless negotiations with the unions. The New Jersey Supreme Court says the state has to go ahead with redrawing legislative districts using 1990 census figures, even though those figures may be revised. Governor Florio and state Democrats prefer to wait for a possible update in July. The Census Bureau is re-examining the numbers based on a federal lawsuit challenging their accuracy. Today on Wall Street, stock prices rose in active trading. The Dow Jones average of 30 industrials gained more than 24 points, ending the day at 2889.11. Big board volume was more than 211 million shares. On the Mercantile Exchange, the price of crude oil rose 49 cents to close at $18.86 a barrel. I'm Louis Dodley.
The difference between nutrition in the suburbs and in the cities is a combination of limited access to a balanced diet, education, and intensive marketing by fast food chains. That's our topic tonight. Our guests are Pedro Espada, founder and executive director of the Soundview Medical Center in the South Bronx. Also, Dr. Norma J. Goodwin, founder and president of Health Watch Information and Promotion Service. They'll be interviewed by tonight's guest host, Shelton Walden, producer and host of Walden's Pond on WBAI Radio. And we will take your phone calls soon at 1-800-245-WNET. This is LiveWire.
Well, the Wall Street Journal did a 6-month study last December on inner city eating habits. Many residents are overweight, hindered by a smorgasbord of high sugar, high fat, high salt food. A crisis of poor nutrition exists in America's inner cities. And tonight we'll be talking with Dr. Norman Goodwin and Pedro Espada. Dr. Goodwin, you're the president of Health Watch Information and Promotion Service, which is a national nonprofit-based nonprofit organization in New York. Tell us what is, in your capacity, what are you finding in America, in the inner city?
Well, it's interesting that we are focusing on nutrition in the inner city because there's really a major, what we call a black-white health status gap in the country. There are 60,000 excess black deaths in the country every year. That's deaths that should not occur. And interestingly enough, if one looks at the causes of those deaths, there's 6 major problems that contribute to most of those deaths. 4 of them relate to nutrition. So there's no way one could be concerned about improving the health and longevity of African Americans, which is what Health Watch is all about, without being concerned about nutrition. Just to mention, the leading cause of death is cardiovascular disease, then cancer. Diabetes is another, and infant mortality. Those are 4 of the 6 major causes of death, and each of those 4 has a very close correlation with nutrition, such things as fat and cholesterol intake, for example, fiber intake, prenatal nutrition, etc.
And what is your organization doing about trying to remedy some of these ills?
Well, the most important thing, it's interesting that I think the intro mentioned a lack of access to nutritious food, which is undoubtedly a major problem. But I would even contend that the largest problem is the inadequacy of culturally sensitive or culturally appropriate health information, because there's a vicious cycle which goes on. If a bodego will only carry skim milk or 1% or 2% milk if there's a demand for it.
Yeah.
And unfortunately, there's not an adequate demand for it today, and I think that's because not enough emphasis has gone to bringing that information about health and lifestyle to the community.
And you disseminate information.
We provide health information and do health promotional activities in the community.
And you also have chapters in other cities as well.
Well, we're doing work in 4 additional cities in addition to New York City. Well, we're doing Bed-Stuy, Bedford-Stuyvesant, Harlem, Newark, Philadelphia, and Baltimore, and we expect to be extending our services beyond that.
And what has been the response to?
Well, interestingly enough, the response is favorable, but it's difficult because health is not the top priority of the inner city resident. If one, for example, thinks of the middle income, the upper income population in America, for the past decade or more, we've had a health improvement, a self-care movement, more jogging, more physical activity, more of a demand for the right kinds of foods, fruits and vegetables. Unfortunately, in the inner city, there has been a necessary concern about what we can call survival things, housing, clothing, food, without even dealing with what kind of food.
Exactly.
And so health is unfortunately way down on the list on a relative scale. And one is not going to really change lifestyle and behavior as it relates to health until one gets the information, is able to have the community understand that they deserve and really need to have more healthy nutrition.
Pedro Espada, who's the president of Soundview Medical Center, you've been there for 12 years. Tell the audience a little bit about your organization and what is happening there in terms of nutrition and trying to get the good word out.
Sure, Sheldon. Well, Soundview Health Center is a medical provider in the southeast Bronx. We provide a comprehensive set of services to a working class and poor community. We're beating the drums about how the elements that Dr. Goodwin mentioned are essentially poisoning our community. And I use strong language in that fashion because that's exactly what is happening. We have the kinds of crisis proportions that we've mentioned. What else can we call it when we have a situation where we have cardiovascular disease, diabetes, all of the other categories of diseases that were mentioned, and we're feeding this population high-fat, high-sodium, high-sugar products. And major corporations, the American icon, McDonald's, and others, have targeted these communities, much like the tobacco industry has targeted these communities, to essentially sell them these products, knowing fully well that they will have deleterious effects on their health. So clearly, those of us in the public health field feel a special obligation to point out the obligation that these major corporate outfits must have, because we in the grassroots level, and clearly a laudable program in terms of health promotion, disease prevention, like Dr. Goodwin's, is essential. But if you look at the healthcare dollar versus the marketing dollar, you will see that clearly there's a lot more. 20% of the promotional dollar that McDonald's may have will go towards selling this poison to our communities for a host of reasons that we'll get into.
Let me hold your thought for a second. We'll get back to that in a minute. We have a call from Vincent in Jersey City. Hello?